Hello, hello. Welcome to another episode of Candid Catholic Convos. My name is Rachel Trochet, and today I'm powering through a cold. It's very obvious my voice is nasally and rasp, my eyes are tired, and I don't look my very best because I don't feel my very best. It's frustrating for sure. I mean, who really wants to feel crummy for 5 to 7-ish days? But I know it's temporary, and I have faith that I will get better and be back to normal before I know it. What's not so obvious is I also struggle with chronic invisible illnesses as well. Depression and anxiety are the two that I'm most open about, but to be honest, I've spent the last 5 years seeking answers as to why I still don't feel well. I can't tell you how vindicating it was to finally find a doctor who not only believed me, but was also willing to find an answer, to give whatever I was going through a name, and to finally start treating it. The sad thing is, this is such a common story for so many people who feel helpless in their quest for answers or isolated in the complexity of their symptoms when it leaves them feeling misunderstood by peers. It's hard to have faith that things will get better or that this suffering is there for a reason. Instead of drawing closer to God, it often feels like we've been abandoned. Pope Francis wrote, "God does not abandon us and often amazes us by granting us strength that we never expected and would have never found on our own." He likened the journey of the ill to that of the disciples on the road to Emmaus, who recognized Jesus traveling with them only after they had shared their anxieties and disappointments with him. So how can we keep the faith during times of illness and uncertainty? How can we reinvigorate our hope and draw closer to God instead of feeling abandoned? Today, I'm joined by Dr. Greg Burke, a physician and president of the local Catholic Medical Association, to talk about the intersection of faith and medicine, how we can maintain our faith in sickness and in health, and how faith informs our choices. Dr. Burke, thank you so much for taking the time to sit down with me on Candid Catholic Convos. I'm really excited to get to talk to you about this topic that I understand that you're very passionate about.
Yes, Rachel, thank you for reaching out. Yeah, it is a passion of mine. I think it's going to be of interest to a lot of people because
Absolutely.
who doesn't worry about their health or have issues at some time in their life? So it could be
Exactly.
more
We all have
important
a
in some ways.
doctor. Yeah.
Right, sure.
So let's get started with probably what I found to be the hardest question for a lot of people is tell me a little bit about yourself.
Yeah, I hope it's not too hard for me, but yeah. So I'm a physician, an internist, practice here in the north part of the diocese at Geisinger, and there's always that disclaimer, whatever I say is me, it's not necessarily the health system. And I've been here almost 33 years practicing internal medicine. I chose to come here because it's a teaching hospital and I would have opportunities to interact with students and residents and consultants. And I had trained in Philadelphia at a large academic center. So this felt like it would be like coming home. But it was also central Pennsylvania, and I grew up in Northeast Pennsylvania. It also really felt like home in many good ways. Married, I have 4 daughters, all practicing Catholics with very new and I'm saying very nice son-in-laws. So family growth has been a success in a good way. I've had an interest in ethics, bioethics, and the Catholic tradition since my training as a medical student and resident. So that goes back to the 1980s. So a long time with an interest in that. So practicing internist here in the diocese and um, a participant here in the parish life at St. Joseph's in Danville, a very wonderful parish. So I hope that's kind of enough background for you, Rachel, but happy to answer any questions.
No, that's wonderful. And I love that you're able to, that you've taken that interest in bioethics and really kind of married it to what you do for a living. And in my research and preparing for this episode, I learned that you're also the president of the Catholic Medical Association. Is that correct?
Well, not of the whole association. So I'll give a little bit of clarity. It's the presence of the Harrisburg Guild. So I think that's an important distinction. I'll talk a little about this. So the Catholic Medical Association is an association of guilds throughout the United States. Started that process, gosh, it's been almost 100 years ago. And it was had a very fancy name at one point, the National Federation of Catholic Physician Guilds. So it was not uncommon in the 1920s, 30s, 40s, 50s, 60s to have guilds in separate dioceses or separate large urban areas like New York City or Philadelphia or Chicago, where Catholic physicians would come together, form a guild based on Catholic principle and fellowship. They would have what was called a white mass every year together, maybe with their bishop, or put on special events. Uh, but many, many years ago, it was decided to form a national organization of those guilds, and that current name is the Catholic Medical Association. I do serve on the board in, for that entity as the secretary, but the Harrisburg Guild's been around since 2008. That was under Bishop Rhodes. We were incorporated, so to speak. We had approval. Usually it takes several Catholic doctors together saying we want to promote Catholic medicine or the understanding of our Catholic faith in the practice of medicine, getting the approval of the ordinary of the bishop, and then you have a guild. You're kind of part of that national group, but you have sort of local control. You can set up your own events. You can have speakers. You can have days of recollection, which we do every year. You can have our white mass with the bishop every year. So we're one smaller guild and part of a larger national organization of about almost, I think, about 120 guilds now throughout the United States.
That's really cool. It's something that I feel like a lot of people don't necessarily know a lot about because, medicine and faith always seemed like two very separate things when in fact
Sure.
they work very well together.
Yeah, no, I think that's a great point, Rachel, because it's the chronic debate, which I really think is not a debate. I think that's a misnomer between faith and reason. And this has been growing over the last 50 or 60 years that somehow science and faith are in competition. That's a false dichotomy. They are not. The Catholic tradition has always been respectful of science and its exploration of truth. And I think science often needs faith to complete its journey and to understand that in the bigger world of metaphysics and philosophy and reality of our spiritual nature. So they're complementary. They're often seen in opposition. But as a Catholic physician, and I think our view within our guild in Harrisburg and even nationally is that they're not in competition. I think helping to understand that. I'm trying to think now of the mission of our national organization of the Catholic Medical Association is to really work with young doctors, new doctors, those who've been in practice, to help them bring the Catholic faith to the science and practice of medicine. That's really our mission. Ultimately, our vision is to inspire physicians to imitate Jesus Christ, and almost in a ministry way. So I hope that's answering your question. But yeah, that faith and reason thing, many people believe there's great competition or that they can't be held together in common intellectually or in practice, but that's not my belief. It's not the belief of the Catholic Medical Association as well.
I think that's fascinating. I really like that picture that you painted for us of that, medicine and science and faith like walking this journey hand in hand and like one helps explain the other. I think that's just fascinating. So I'm assuming that your faith really helps inform your decisions when it comes to care for your patients.
Yeah, absolutely. And I don't know how you can separate it. I mean, there are those, I think, in modern culture, secular culture now, who try to separate the two. Sometimes I'll talk about a term I like to use is called transactional medicine, where medicine is simply a service that one can go to, like a supermarket, and pick a particular therapy or intervention, and we provide it. I tend to believe that that's a bit superficial, and that really medicine should be based on relationships with a physician, a nurse, even a health system that goes a bit deeper, and recognizing that human beings are not just physiological bodies, but we're also spirits. In a very Thomistic sense, we're both spirit and body. We're not separated. We're not, not dualists. We're one without the other is not the whole. So to be a human means you have a spiritual life, a soul, but it would not be human without the body. And so there's no contradiction between the two. And so faith, in the practice of medicine to me is critically important. And I think whether we're bringing our Catholic faith to care we're bringing some faith, whether it's faith in science, faith in science of medicine, a humanistic view. But it could be the view as a Jewish physician, a Muslim physician, a Hindu physician. You can't separate that. That's part of our basic human reality of what we are as human beings. So I'm not sure if I'm going a little too deep there for you, Rachel, but I hope that's sort of making sense. I can't separate the two. I treat patients as a physician, but also as a Catholic with that particular worldview that I think, really demonstrates reality. It truly is true.
I really resonate with that because
Mm-hmm.
I've always noticed that like some of my frustration with, um, dealing with, you see all kinds of doctors
Sure.
throughout your life. I really like the way you phrase that transactional medicine. Like it
Oh,
sometimes feels like you're a number or you walk in and you're like,
uh-huh.
well, your numbers say this, and you're like, yeah, but I feel like, did you even look up from the computer and look at me? And I like that you're taking this approach of not just looking at one aspect of the human person, you're looking at
Sure.
them as a whole being.
Yeah, you can never separate them. Every person that's in front of me in the exam room, yes, they have numbers, they have cholesterol amounts, they have blood pressure readings and blood sugar readings. They also have a psychological component, Rachel. So they're dealing with stress or depression or great happiness because there's something really wonderful happening in their lives. But they have a spirit. There is a spiritual nature to every person where they're facing, the existential questions. Why am I here? What's my destiny? What will happen to me when I die? What's the purpose of life? What's the meaning of my own suffering? That is the whole person that I see in front of me. And at different times I toggle. Sometimes I'll focus on the numbers, get the most important thing of the day. Sometimes it may just be the psychological, spiritual that the patient really needs to be addressed. And we have to be prepared as doctors to address all of those potential parts of the human person. So I appreciate what you say. And even us having this video chat right now reminds me that we're doing virtual medicine now, where, you want a prescription and you can go now online, set up an appointment with someone you've not met and have a video chat and they'll send the prescription to the pharmacy. Sometimes I think that's just fine for very simple issues and it's convenient and that's fine. It's a transaction. I still think there's a relationship there that's important. But also be very concerning, as we've done with the abortion pill, where a medication with such serious consequences as the loss of a baby in utero can be done online over state lines. So, yeah, I think you're seeing the point about transactional, and there always has been a transaction in relationships between doctors and patients and so on. But I fear the day that that's all that it becomes, because it's much deeper than that, much, much deeper than that.
You're absolutely right. And when you talk about physicians modeling Jesus Christ as the
Mhm.
healer, I think that that's so important to remember
Uh,
that it is so much deeper than that. But I assume that given your line of work, you've dealt with
mhm,
people from all walks of life, whether they're perfectly healthy or like newborn
mhm.
versus, struggling with some illness or ailment, maybe they're even dying. How
Sure.
has that affected your faith? Have you had any cases that just kind of really rocked your belief?
Oh my gosh. I mean, there are always cases that hit you deeply, and they're the questions that we all ask. Why does evil exist? Why is there such suffering in the world? Some of the most difficult cases that I've seen are when it's more than one person in the family, when it's husband and wife who are suffering simultaneously, one with cancer, one with heart failure, and they're both facing, maybe death soon, and it just seems so unfair. How can this be happening to this couple at the same time? Or the loss of a child, and seeing how that looks, and really struggling with that deep human question of why is there evil? Why do people suffer? Why does an all loving God permit this? And I think we would have to agree a complete answer to that is impossible. There is some mystery to these questions, but there again, one has to have faith that even in those difficulties, God's divine love will answer them at some point and all will be made well. That's the challenge of faith, or as we're experiencing this year, the year of Jubilee, the theologic virtue of hope. But that doesn't mean it doesn't, at any particular moment, Rachel, it can be very challenging to see such suffering and pain and sometimes feel that you have nothing to offer to reduce it, particularly psychological pain. Has been one of my biggest challenges is seeing somebody who just is in deep grief or has deep anxiety or fear. Um, and what is the remedy for that? The remedy is sometimes just to stand with them through that and be there and available and listen. So there's plenty of opportunities to do that in medicine. There are plenty of opportunities to do it in every walk because suffering is sort of universal. We just get more of it in 1 week than most people do in healthcare. We see more of it and sometimes more profoundly, but every human being will, have their own suffering and grief and questions. But anybody who's walks with another in any other profession will feel the same.
You're absolutely right. It's kind of like, I hate to put it so glibly,
Mhm.
but like flavor of the week, like depending on what
Yeah.
your job is, it's like there's different types of suffering. And you're right. Like
Mhm.
physicians see a lot more of it than most people normally
Mhm.
would
Yeah.
in other fit. Like
Yeah.
I don't see a lot of sick and dying people when I'm doing an interview. I mean, if they are, they're not telling me, but it's
Right.
like you said, it's we all experience it in some way. It is very universal.
Mhm.
But I want to talk a little bit about chronic illnesses, especially some of those illnesses that you mentioned that might not be visible, so
Right.
depression, anxiety, or autoimmune conditions, or
Sure.
something that doesn't have, a visual, like you can't automatically tell by looking at somebody that they
Mhm.
are ill. And it's such a heavy cross to bear, especially for those who are directly impacted, but then also those who are caring for them.
Sure.
It can be frustrating, isolating, depressing, and even more so if you're like trying to figure out what this illness is. Like, I don't know what's wrong with me. I know something's wrong. And like, I'm going from place to place to place, and we're trying to put all the puzzle pieces together. I imagine it's just as frustrating for the doctors and the nurses who are working to find an effective treatment. I find it sometimes hard to trust God's plan for our pain.
Mhm.
How do we remain patient in our suffering while we wait? Because eventually we know that there's an eternity where there's no
Sure.
suffering.
Yeah, I mean, you're asking some of the deepest questions that we've asked for since humanity has been with us on Earth. Is how do we deal with chronic pain, being misunderstood? Things I've learned as a physician is a fair degree of humility. That there's a lot of things we don't understand, and that we have to have enough faith in our patients that they're telling us the truth. And medicine doesn't always do a good job. Sometimes, since we hunger for answers and like to put everything in that scientific box, like this is your diagnosis, this is the treatment plan, now we have it boxed away. We've had a tendency in healthcare when we can't put it in a box to push it away somehow, and that could be a hurtful statement like, "Well, it's all in your head." You know, one of the things I've learned, and when I've trained young doctors, is never say that. Nothing is in somebody's head. Um, there are rare cases of what we call malingering, where somebody's actually faking an illness to get something, a disability payment. That is extremely rare. But if somebody says to me, I don't feel well, whether it's psychologic pain, physical pain, and undisclosed illness, that has to be believed. We have to believe, that in the integrity of our patients, and to keep our integrity at the forefront, also be willing to say, I don't know what's wrong, but let's journey through this together. I'm not going to abandon you. Um, I might not fully understand this, but I will still be here as we journey together. And that takes a little bit of humility because in healthcare we've been trained in our earliest days, and I think it's changing, but that you have to show such competency in your work, and you have to, put things, as I said, into a category and give it a name. Um, that we might feel like a failure if we don't diagnose the condition. I think sometimes we just have to say, I'm not sure, or sometimes I'll say this to patients: I can tell you what you don't have, and be pretty confident in that. But I'm less confident to say what you do have. But I'm not going anywhere. We're going to be in this together. And maybe at some point we'll figure it out together. Something I always, try to train our young doctors is to listen to the patient, because this is a true fact. And I've heard it stated maybe as high as 80% of the time, Rachel, the patient is telling you what's wrong if you just listen. The diagnostic tests, the blood work, the x-rays, they can be helpful, confirmatory. But the patient, if you just listen a little bit better, they'll tell you what's wrong. I've learned over the years to ask this question more often: what do you think's wrong? And I've been surprised a few times. There's been some suggestions that are pretty darn good, or that will pursue and say, you were right. That really was a Lyme rash from Lyme disease, or it really was your heart. I know it sounded atypical. I didn't think it was, but you said, I think it is. And we pursued it, and you were right. The patient was trying to tell us what was wrong, and we need to listen. I think we're better at it now than we might have been 50 years ago, but it's an ongoing, journey. We'll never be perfect. Nobody ever is perfect. But I think, it's a worthy goal to try to listen better.
That's why it's called a practice, right? And we practice.
For the rest of our career, we're practicing. Well said, Rachel. Well said.
I love that. I feel like that listening is such an important aspect, not just in medicine, but in life. And just from personal experience, the doctors that have actually listened to what's going on with me have been, we've actually been able to dig in and find. I remember I just had a doctor's appointment last week, and I looked at the woman, and she was explaining my blood test to me, and I was like, so I'm not crazy. It is this. And she's like, no, you're not crazy. It can feel that way, especially when you're battling something that is it's not a broken bone. My arm isn't just hanging out of its socket kind of thing. But I think that that's so validating to hear that the physicians that are training under you, you're equipping them with this empathy to listen and to, pursue. Because again, we're treating the whole person. I think that
right. I'm glad you said the word empathy. I think that's probably the critical missing ingredient. There's been more talk about empathy, and I think it's we need to demonstrate it more. I mean, some of it has an emotional component. Like, do I feel empathic? Can I sense the other person's pain? Sometimes I realize in our humanity, our emotions don't always catch up with our actions. And there'll be days when I may be hearing a terrible situation. Someone's, I'll have to break some very bad news, or someone has passed away and I need to talk to the family. And emotionally, I haven't caught up with that. But I can still demonstrate empathy. The empathy may come 4 hours later. And that's happened to me, where in the moment, I'm kind of numb. But I've learned the empathic skills of listening, the right words to say, the right body language to play. These are learned skills. And it's possible 4 hours later, then the emotion may hit. But it's important, if I've learned about the empathy, that I can demonstrate it. But it doesn't have to always have to have an emotional component at the moment, because in healthcare, as I said, in any course of a week, there may be so many things thrown at you that it's almost impossible to emotionally respond every time. But I think we can always, always, always demonstrate empathy. And it's a mindset. And, we need to have it more often. I hope that's answering the question for you, but I'm really so glad you chose that word, empathy. It's really, to me, it's sort of the holy grail in medicine, is that we create a world where our clinicians, our doctors, have empathy first. But, I'll say this, I say it to my doctor colleagues all the time: Rachel, competency has to be assured. So, there's a quality and safety part of medicine that can't be ignored. We have to have great diagnostic skills. We have to know medicine very well. We have to know surgical techniques as experts. We have to take our boards. We have to study well. We have to be safe in everything we do. And that should be assured. But as I tell my colleagues, okay, assuming that's all there, the crowning jewel on then is empathy. In every patient, we want all those components: the quality, the diagnostic skill, the competency, with empathy, to be there in the clinician who sits in front of them. And so that's what I think we should be trying to work for. I think, decades ago, the competency part was the main thing that was looked. Is your surgical technique very good? Dr. Burke, what are your diagnostic skills? Are you good at making diagnoses or interpreting tests? And okay, you're now a doctor. I can't say that, even when I trained 40 years ago, yeah, the idea of empathy was there and about doing the right thing, professionalism. But I think there has been an increasing interest in it, maybe because as we've drifted away from it, or in our current culture, where we've become more transactional, where we've developed video medicine, where things are more distant in culture. Um, Maybe there's a recognition we have to go back to our roots. And empathy was the word that you chose, and I'm glad you chose it.
It's such a powerful word, and I feel like it's so applicable to medicine.
Mhm.
Um, I want to talk a little bit about, I mean, you've practiced for decades. What have you learned about life and especially about faith from those who have both overcome ailments or those who maybe have succumbed to them?
Yeah, I mean, there's lessons to be learned in many ways. Some of them inspirational. I've taken care of patients and observed things. People that just showed such courage and fidelity to faith, a love of their family, enduring pain and suffering with finding deeper meaning, even offering it up for others. Those who've asked for the sacraments at the end of life. Those who reconciled with their families, if there's been issues they're inspirational. They talk about something called the ars moriendi, the art of dying well. And I've seen it. And this goes back to the Middle Ages. The Catholic Church has always talked about the ars moriendi, that, reconciling with family, reconciling with the Lord, setting your life straight because you recognize that the time is short. I remember my father, he died of lung cancer. This is many years ago. And I think it was the night that he, found out the diagnosis, and it was very somber. He left the hospital. He didn't want to be in the hospital any longer. And I remember going into the bedroom. And he was watching the Phillies game in the summer, and which was what he was, I think, do on any normal night. But he was alone, and not one. He was not one to have many profound discussions about these things. He was a proud man, and he said one thing that I'll never forget. He said, I always thought I would go very quickly because he had heart disease, and he thought I'll just probably have a heart attack. And in some ways, that's kind of what I wanted. And this is going to be harder. Meaning he had a diagnosis of advanced lung cancer. He knew the prognosis was poor. But this was almost, I thought, in a way, his early Catholic thinking as through parochial school and up. He said, I think it's better because you have some time to prepare. And I think he was speaking spiritually. He was thinking of what he had always trained himself to hear. There's a famous prayer from Saint Joseph for the dying, but it always like, spare me from sudden death. Give me some time to know that the end is near. So I have a chance to spiritually prepare, to reconcile, to get closer to the Lord, to have the sacraments. And I totally get where he was coming from. And he was recognizing it was going to be more difficult, but maybe more beneficial. And I've seen that, but I've also seen the downside with those who um, approach death without faith. And they're can be often very afraid, or trying to figure out the unfairness of it all. Not that faith is always gives the answer, but um, and the distress that can bring, and how sad that can be. Also, how brokenness and sin affects how we might spend our last days on earth. If there's dysfunction in families and hurts, things that have not been healed because the wounds were so so deep, that's very sad to see. Um, and it's always reminded me, try to keep my relationships in good orders, ask for forgiveness, always reconcile with your family. Don't let wounds fester, so that if something changes in your life suddenly becomes shortened, or even an immediate loss of life, that you're reconciled. Because I've seen the danger that if you don't have that it can bring for many people as they face death and illness. Um, some basic wisdom there, very Catholic. I don't think it's just Catholic. I think it's universal. Um, and I think that's leading the moral life. And in medicine, for me, that's always been, what kind of distinguishes a Catholic doctor, Rachel, is sort of these ethical principles that the world really doesn't endorse anymore, but have deeper meaning. And I think hopefully will add to why patients may trust us. Our commitment to the sanctity of life, our rejection of euthanasia and assisted suicide, and even things that are popular like in vitro fertilization and stuff. Some of these things are hard to explain to others, but holistically, the church's teaching on these things puts the human being and their flourishing at the center, recognizes where peace may be found and where things to avoid, even though they can be attractive at the moment. If you go those routes, often disasters at the other end and hurt and wounding and woundedness. So the Catholic moral tradition in medicine has always been my guide, and it can be difficult to live up to. I know I've had those conversations with patients where they're requesting a vasectomy, or I've even had the abortion issue come up, and I'll say I can't participate in that because of conscience, but also because I care for you as a person, and this is not going to lead to your flourishing, to your ultimate happiness in life. And those can be difficult conversations, but the faith has guided me in the practice of medicine. So at the end of the day, I felt I've kept that flame alive of what virtuous medicine can look like. I'm not a virtuous person, but the ideal of how to live that out has remained all these years.
It's a practice, just like medicine.
Yeah, that's a great point. You've made it twice now, and it reminds me. I have to explore the word practice. It probably goes back to Aristotle or something. And my daughter, who's a philosopher, will educate me on why we call it practice. But it probably because it does require lifelong learning and openness, not to keep closed-minded, but to keep grounded in those, like, as I said, eternal, unchanging truths about the human person. That life is a gift, therefore we don't own it, so we can't take another's, and we can't encourage someone to take their own life. That's a fundamental truth of faith, that life is a gift and has to be treasured. The way we act out our sexuality, the way we act out relationship, also has a giftedness to it, an inherent, way that it's to be lived rightly. And so all of these things, I think, are important in the practice of medicine. In many ways, we've violated all the time as a profession, and and we may be in a minority, but I think Catholic doctors have the answer in many ways to the ills of society. But we just have to keep fighting, for our voices to be heard.
Absolutely. Well, Dr. Burke, thank you so much for sharing this wisdom with us and for doing the work that you do. I think that you're making a huge impact on the lives of so many people. I almost wish that I could come up to Danville so you could be my doctor. But I really appreciate
not that far.
I really appreciate you spending the time with us this afternoon. So thank you.
It's been great. And thanks for getting the word out about our local guilds. We have some wonderful members and about the Catholic Medical Association. It's a wonderful organization. It's growing, but we need a lot of prayer. The world is kind of tough out there. We're in a minority. So anybody who's listening or watching, please pray for us. We really can benefit from the prayer.